Good morning again. My name is Raisha. I will be conducting the presentation today, and it is Medicare and your UC sponsored plan. I'd also like to introduce my counterpart, which is Lilia Cuato. She will be the second HCF here at UC San Diego, and she will be partnering with me. It won't let me move my mouse over without changing the slide. But anyways, let's go ahead and get started. So the Medicare basics is what we'll be covering today. Your UC Medicare requirements, plan options, premiums, how Medicare and your plan works together, and then we'll leave you with some tools and resources. Now the fun begins. Let's talk Medicare. Don't be scared. It's not that bad, I promise. So Medicare is a federal program that provides healthcare coverage for individuals who meet certain criteria, 65 or older, with 10 years of work experience or 40 employment credits, under the age of 65 and disabled, and that is determined by Social Security, under the age of 65 and disabled, as I said, receiving Social Security income for at least 24 months, end-stage renal disease, or if you're an unmarried disabled child over the age of 20 who was disabled prior to the age of 22. There are several parts of Medicare. You have Part A, which is your hospital coverage, your inpatient, home health care, skilled nursing facilities, hospice care. You have Part B, which is your doctor's visits, ambulance transportation, labs and x-rays, physical therapy, and DME, which is the medical equipment. You have Part C, which is your Medicare Advantage plans, which covers all A, B, and D. And then you have Part D, which is your prescription drug coverage. Medicare premiums are based on income from 2 years prior. So for 2023, your rates will be based on your 2021 income, whether that was a joint return or an individual return. Most people qualify for Medicare and receive Part A premium free if they paid into FICA taxes for 10 years and have 40 employment credits. If you have less than 40 employment credits, you will pay a premium. For those who have 30 to 39 credits, you will pay $278 per month, and those who have 0 to 29 credits may pay a premium of $506. Medicare Part B will always have a premium, and it is deducted straight from your Social Security check if you are receiving Social Security. Part D, unless you're in the higher income bracket, there is usually a zero premium as well. And as you can see from this slide, it gives you a breakdown of individual return amounts and how much your premium would be, and joint return amounts and how much your premium would be. Majority of the people are paying the base at $164.90. And we want you to remember this Medicare premium that you see on the screen here is in addition to your medical plan premium. And we will discuss that a little later in the presentation. When can you enroll in Medicare? There are 3 enrollment periods. The first enrollment period is the initial enrollment period. This is the time when you become eligible at the age of 65. That's a 7-month period, 3 months prior to your 65th birthday, your birthday month, and then 3 months after. Then you have the second enrollment period, which is your special enrollment period. And those are for people who delayed enrolling because they were employed. And that is an 8-month period. It's the first day of the month that your coverage ends. We recommend that you enroll 3 months prior to when your coverage is going to end, so you don't have any lapse in coverage. And then we have the general enrollment period. And that is for anyone who did not enroll between the first initial enrollment and the special enrollment periods. And that's 3-month period every single year from January 1st to March 31st. And your coverage will start July 1. No matter when you enroll during that 3 months, it will not begin until July 1. Now, who are the Medicare experts? You have Social Security. That's where you would go to enroll, determine if you're eligible, pay any of your premiums, and ask for an ID replacement. Then you have the CMS, Centers for Medicare and Medicaid Services, and they're the experts on claims, coverage, and how to understand your explanation of benefits. And then we have HICAP, and they're the experts on helping people understand Medicare and solve Medicare issues. So this is the landing page for the Social Security website, www.ssa.gov. And this is the page you will go to when you sign up for Medicare. You can also check your account to see how many work credits you have. You can check your application status and obtain replacement Medicare cards. So what are UC's requirements? Everything you need to know about what UC requires of you when it comes to Medicare can be found in this Medicare fact sheet, which is located on UCNet. And a link to this fact sheet will be provided to you in the tools and resources at the end of the presentation. If you're eligible for Medicare while you're still working and do not plan to retire, your enrollment in Medicare is optional. Some employees will enroll in Part A because it's free and delay Part B because there will always be a premium that you'll have to pay. If you plan on continuing to work after 65, you will remain covered on the UC medical plan. The only exception to that is the health savings plan. You will need to delay enrollment in both A and B because it does not accept any parts of Medicare. And then we have Kaiser, where you can enroll in both A and B while working if your Medicare premium is less than what you pay out of pocket on a monthly basis. Kaiser is the only one that will do this, and they will waive your co-payments if you enroll in Medicare A and B while you're still working. Okay, so UC requires that all retirees over the age of 65 enroll in Medicare. If you're eligible for premium-free Part A, you must enroll in Medicare Part B. So the reason they do this is to offset the cost of retiree health. Ensuring a retiree costs twice as much or more than an active employee. So enrolling in Medicare allows UC to offset the costs and pass those savings down to the retiree. In order to enroll in a UC-sponsored Medicare plan, you must enroll in both Part A and Part B. Failure to comply will result in penalties and permanent loss of UC medical coverage. The two exceptions are those that retire prior to July 1 and those that reside outside of the United States. Should note that even though you might not be eligible for Medicare, you should still apply and provide that denial letter to RASC. If you live outside of the U.S. and you move back to the United States, UC will require you to enroll in Medicare, and Medicare may assess a late enrollment penalty. So UBIN forms assigning prescription drug coverage. If you're eligible for Medicare, when you retire, you have to complete one of these prescription drug forms according to the plan you are currently enrolled in. So if you are in blue and gold, you will complete the UBIN 121 to enroll in UC Medicare Choice. If you're in Kaiser, complete the UBIN 127 to enroll in Kaiser Senior Advantage, Core, UC Care, 123 UBIN, to enroll in in UC Medicare PPO. And then, as you can see, there is no UBIN form for the health savings plan because it is not compatible with Medicare and cannot be chosen. As I earlier stated, if you're not eligible for Medicare, you may be eligible in another way. If you didn't earn any credits, you may qualify under your current spouse's work record when they turn the age of 62. If you're single now, but previously for at least 10 years, you might be eligible under a former spouse when they turn 62. Again, that Medicare fact sheet is where you can find everything you need to know without, so you do not get a penalty. Again, in order for you to know if you're eligible under a former spouse or current spouse, that is Social Security will make that determination when you put in your application. So if you are aging into Medicare after retirement, UC will send you instructions on Medicare and how to enroll 3 months prior to your 65th birthday. They refer to this packet as the aging in packet. In this example, this person is aging 65 in the month of April. UC will send you a notice to enroll in Medicare Part A and Part B in June. And you have 3 months, technically 3 months, January, February, March, to complete your Medicare enrollment. If you do not apply for Medicare within that 3-month period, UC will assess a penalty that will be deducted from your pension for 3 months. Yeah. Can we without exiting out?
I think we have to help us. But I'll go.
Sorry, just 1 second, you guys.
Not sure who it is.
Okay, so if you do not respond to that packet and enroll in Medicare, UC is actually going to assess a penalty from your pension check for 3 months. And right now that penalty amount is $419.60. They did suspend this penalty for a while during COVID, but it is coming back. So please, you do not want this $419 to come out of your pension check for not enrolling. Enroll in a timely manner. Back to the whole thing again. Okay. Now, most plans with Medicare prescription drug coverage have a coverage gap that they call a donut hole. And that means that after you and your drug plan have spent a certain amount of money for covered drugs, you have to pay out-of-pocket costs for your prescription drug up to a yearly limit. So we wanted to make sure we told you that UC Part D plans do not have a donut hole. There is no gap in coverage. You don't have to spend a certain amount in order for you to get your Medicare Part D. It's automatic. You would just complete the form, the UBIN forms that we spoke about a couple slides ago, and enroll in that part, assign your plan to your Part D coverage. We also wanted to make sure we noted that there should be no Part D coverage, duplicate coverage. So you should not be applying for any outside Part D plans because your UC plan has Part D encompassed in the plan. If you do enroll in an outside Part D plan, outside meaning non-UC, it may result in a loss of coverage. UC will drop your coverage for having another Part D plan. The only exceptions to that, of course, are the UC Medicare PPO plan that is without prescription drugs. And then we also have those that are on TRICARE for Life, or they have more than one coverage with CalPERS and CalSTRS and UC Medicare. Okay, so how are Medicare premiums paid? So the Medicare amount if you're already collecting Social Security, they'll automatically enroll you and begin deducting that Medicare premium out of your Social Security income. If you're not collecting Social Security, again, start applying for Medicare 3 months prior to your 65th birthday, either in person, online, or over the phone. And then you would need to set up payment arrangements with Social Security. What they usually do is they'll send you a quarterly statement. So 3 months worth of premiums. They'll send it to you, and you can either go online and pay your Medicare premium, or you can mail in your payment. If you're not Medicare eligible, again, request that denial letter from Social Security. Send that to UC, and you will stay on your non-Medicare plan, whatever that may be. Straight Kaiser, UC Blue and Gold, Core, UC Care. So what are your options? So your options, of course, depends on where you live. So in California, your Medicare options are UC Medicare PPO with or without prescription drugs, UC High Option. Please note, UC High Option is only available to enroll during open enrollment, and all your members in your family must be enrolled in Medicare in order to get onto UC High Option. And then you have Kaiser Senior Advantage and UC Medicare Choice administered by United Healthcare. In a state outside of California, you only have the 2 PPO plans, Medicare PPO with and without prescription drugs. Now, if you have everyone in your family outside of California is enrolled in Medicare, you will pick a plan through VIA Benefits. And we'll talk about VIA Benefits a little later in the program or in the presentation. If you live abroad, Medicare is not accepted abroad, so you have the choice of being in UC Care or Core. One question that we receive very often is if I'm not eligible for Medicare, or if I'm on Medicare and I have family members that are not Medicare eligible or age, you are considered a split or a mixed Medicare family. So whatever plan the retiree is on would drive the plan that the non-Medicare members or the dependents would be on. So if you are on UC Medicare Choice, your non-Medicare members would be on UC Blue and Gold, and you can see the rest of them here. So Core Care, Anthem stays Anthem, and then of course UC Health Savings Plan. You have to choose another plan. Premiums. Will the premiums increase? Yes, they will. So retiree premiums are based on the following: your retirement tier, of course, your years of service credit, what coverage level you're at, the plan you choose, and if you're Medicare eligible or if somebody in your family is Medicare eligible. And then we wanted to make sure you note that for the UCRP service credit, it's based on whole numbers. It's not, they won't round up, they actually round down. So for instance, if you have 6.9 years of UCRP service credit, they're going to round it down to 16. They're not going to round it up to 70. So just make note of that. Now here's an example of some plan premiums. Okay, so this is a retiree covering a spouse or child, and everyone in the family is enrolled in Medicare. So they're enrolled in the UC Medicare PPO plan. For this family, their premium would be $233.26. And that's for somebody, as you see here, is 20 plus years. So that means they are receiving 100% UC contribution. And also I wanted to note here that you see there's Medicare Part B reimbursement on some of the plans. And that is when the plan premium overall is so low that the UC contribution is in excess. So they're going to give you that money back. So for instance, if you look under the right above the highlighted area to the UC Medicare Choice plan, your premium, if you have 20 plus years, is 0. And then if you look right under it, it says Part B reimbursement. So that person, whoever it may be, if it's just themselves, they'll get $84. If we go to the next one, if it's themselves and their spouse, then they're both on Medicare, they're going to get $168 back on their pension check, and nothing is coming out for medical. Now, this is somebody that we did a side-by-side comparison of somebody that had 20 years versus someone who has 10 years. So that's a big difference between 100% UC contribution and 50% UC contribution. The one on the left, we already discussed, $233.26 for themselves and another Medicare eligible person in their family. And then if you go over to the 50%, that same plan for somebody that's only worked 10 years is $566.48. So you're paying an extra $300 a month rather than the person that has 100% UC contribution. So years matter. Okay, so this is an example. I wanted to kind of give you an example of how the premiums are determined. So the total premium for UC Medicare PPO is $899.70. So this is what the plan charges UC for anybody in this category. Now, the max that UC will pay of the $899 is $666.44. I always get tongue-tied on that one. So since this person has 100% UC contribution, that max contribution, they're going to pay all of it, right? And then you pay the difference, the $233.26. Now, if this person on Medicare, right? We talked about that Medicare Part B premium of $164.90. So you have this person that's going to pay the $233.26 straight out of the pension. And then themselves, which is the first $164.90. Then their spouse, $164.90. They're going to pay a total of $563.06 for Medicare and their plan. That's their total cost for health insurance per month. Does that make sense? Yeah. Okay. So premium payments, your Medicare payments are paid by you either out of your Social Security income, Medicare Easy Pay online, or through quarterly billing in the mail. Your UC premiums are deducted from your UC pension check. And then you have the Part B reimbursement, which is in addition to your credit on your UC pension check. And it's usually available to only those that are in the least expensive plan. So Kaiser has a Part B, UC Medicare Choice has a Part B reimbursement. Advantage plans. So we do have Advantage plans. We have two Advantage plans, Kaiser Senior Advantage and UC Medicare Choice PPO, which is administered by United Healthcare. If you have Medicare A and B and you're enrolled in one of these plans, you must assign your Medicare benefits to your plan by using the UBIN forms. And when you're in an Advantage plan, your plan is primary and Medicare is secondary. Now with the PPO plans, Medicare is primary and the plan is secondary. So Advantage plans, your Medicare pays a flat fee to the insurance company, and it cannot be used separately from the plan. So when you go to the doctor, you would present your plan card and not necessarily your Medicare card, because the plan is going to trump anything with Medicare. Now, this is a side-by-side with what you would be currently receiving under Kaiser. And then if you were to go into the Senior Advantage, how the charges and the pricing and the things that are offered would change. Now, some things remain the same, like the inpatient mental health inpatient is still going to be $250, whether you're on Kaiser or the Senior Advantage. However, the emergency services will go down when you go into Senior Advantage to $65, and they're both waived if admitted. Prescription drug coverage remains the same. Your wellness resources remain the same. For your eyeglasses, you actually get a $150 allowance on Kaiser Senior Advantage for lenses, contacts, and frames every 24 months. Behavior health, there's no Optum coverage under Senior Advantage, but you do still have Kaiser. And then for the hearing aids, for Senior Advantage, you get a boost of $2,500 allowance for hearing aids per ear every 36 months. If there's anything over $2,500, you would make that payment on the remaining balance. For acupuncture, under regular Kaiser, you have combined visits. Kaiser Senior Advantage is just a $20 copayment, but it has to be medically necessary, and it has to be approved by the plan provider. So prior authorization is needed. And that's the same for chiropractic care. Where are we at? Okay. Annual out-of-pocket is $1,500 medical per member and $6,550 prescription per member, which changes from Kaiser, regular Kaiser. And then you have, regardless of which one you're in, you do have the Target clinics where you can pay a $0 copayment for preventative care and $20 for non-emergent services. And then this is UC Blue and Gold versus UC Medicare Choice. Again, inpatient stays the same, outpatient services stay the same, or surgery stays the same. ER visits, $65, it goes down, and those are off. It's also waived if admitted. Prescription drug coverage pretty much remains the same. Office visits remains the same. Your hearing aids, you get $2,000 every 3 years, not the 50% as it is in Blue and Gold. And then acupuncture, chiropractic. Currently under UC Blue and Gold, you have the combined visits. For UC Medicare Choice, you have each benefit has 24 visits instead of 24 combined visits, which is great. Telehealth services are the same, but you also have, in addition, you have behavioral health visits with Amwell, and then the doctors on demand and teledoc with UC Medicare Choice. And then with UC Medicare Choice, they do have Renew Active, which is a gym network where you can get discounts on gym memberships, kind of like Silver Sneakers, but for UC Medicare Choice. You also have 28 post-hospital discharge meals and 12 one-way trips to your follow-up appointments. And then they're offering the emergency response system by Lifeline. So it's that Life Alert bracelet. If you were to fall, you can press the button and the ambulance will come or what have you. They do provide those free of charge to people on UC Medicare Choice. Physicians group. So you know UC Blue and Gold is an HMO, so you have to pick a physicians group. Well, with UC Medicare Choice, you have open access, as if it functions as an HMO, but you can do everything that a PPO does. Self-refer, as long as the provider accepts Medicare and the plan. If the provider accepts both, you're good to go. Annual out-of-pocket maximum, UC Medicare Choice, $1,500 medical per person, $2,000 prescription per person. And then for Medicare Choice, worldwide coverage, urgent care services, and you can use the plan out abroad for up to 6 months. And then we have the supplemental plans that I spoke about earlier, PPO plans. So with the supplemental PPO plans with Anthem is going to be secondary, and that's why it's called a supplement. It's a supplement to your Medicare. So Anthem is Medicare's primary, Anthem is secondary. Medicare certified providers must be used. So you should ask, if you're going to go see somebody new, ask them if they're accepting new Medicare patients before you make an appointment. So again, Medicare's primary, Anthem Blue Cross is your supplement plan. This is for UC Medicare PPO. You have a $100 deductible. You won't pay anything for inpatient services until you're there for more than 90 days or 60 days, sorry. And then with the PPO plans, they have the 80-20. So for your behavioral, physician, and chiropractic visits, you're either going to pay 20% of the total bill or 20% plus any remaining balance. So they're going to pay 80%, you pay 20%. There's no eyeglass coverage, so we suggest that you enroll or stay enrolled in VSP. Hearing aids and acupuncture are not covered by Medicare, and then that goes to the 80-20 rule because it's not covered by Medicare. And then your annual out-of-pocket, $1,500 medical, $7,400 prescription drugs per member. Again, there's telehealth availability with live online, worldwide coverage up to 6 months. If you're going to be outside of the United States more than 6 months, you should enroll in UC Care or CORE. Again, Medicare approved providers must be used. And pretty much the same goes for UC High Option. As I explained earlier, this plan is only available during open enrollment when all family members are enrolled in Medicare Part A and Part B. So there's a $50 deductible. After that deductible is paid, your services, most services are at 100%. So that's why this is a very sought after plan. Your inpatient services, you don't have a copayment until after the first 90 days, and then you will pay 20% of your total bill. No copayment for physicians or chiropractic visits. You would pay nothing for mental health services if they're covered by Medicare. Otherwise, whatever services are not covered by Medicare, you'll pay that 20%. Prescription drug coverage is through Navitus, and it pretty much stays the same as what it was with UC Care. There's no eyeglass coverage with this plan either. Hearing aids and acupuncture, again, are not covered by Medicare, so you'll do the 80-20 there. You have telehealth, which is the same, and the same worldwide coverage, 6 months. This plan, you also have to use Medicare approved providers. The health savings plan, as we stated, it's not compatible with Medicare Part A and Part B, and is not open for new enrollment for retirees. If you or your family's member become eligible for Medicare, you must contact RASC for these retirees and enroll in a different UC plan. You can continue to use your funds for eligible expenses, but you cannot contribute the month your Medicare starts. Oh, and then the balance at 65, you can take it as a distribution, but you'll be taxed at a normal income unless you're using it for eligible expenses. Okay, so behavioral health plans. So your behavioral health plan administrator is dependent on the plans that you are currently enrolled in. So if you have members in UC Blue and Gold, MHN or Managed Health Network is where they would be receiving their behavioral health services. For Kaiser, regular non-Medicare, you have two choices, Kaiser or Optum, but with Senior Advantage, Kaiser is the only option. And then for all the Anthem PPO plans, Health Savings Plan, Medicare, Core, and Care, Anthem Blue Cross is your provider. And then for Choice, United Healthcare is your provider. And then we also wanted to make sure that we note that even if you are retired, FSAP or the Faculty Staff Assistance Program is still available to you and your family members. You can just call or send them an email to set up some counseling if that's what you need. VIA benefits. This is for retirees that live outside the state of California, and all family members are enrolled in Medicare. Your benefits administrator will be through VIA benefits. VIA benefits is UC's Medicare coordinator program for retirees living outside of the state of California. It offers choice, value, flexibility, and support. What UC does is we provide an annual contribution to each covered family member, and it's under what we call a health reimbursement account. So each covered family member, you can actually choose different plans if you want, and the plan premiums and all that would go according to what plan you pick and what state you're in. So when you contact VIA benefits, they'll ask you what your needs are, what your family's needs are. And if one person wants to be in an HMO, say for instance, Kaiser, they want to keep Kaiser even though they're outside of the state of California. If Kaiser's available in their state, they can choose Kaiser while their family goes on Aetna, if Aetna is available in their state. So you don't have to be on the same plan when you're enrolled in VIA benefits. Now, UC will provide that annual contribution, depending on your years of service, from $1,500 to $3,000. They'll put that in the health reimbursement account. And what it does is you're going to pay your provider. So you go to the doctor and they charge you $200 for a physical. You're going to pay $200 for that physical, and then you're going to get reimbursed from your health reimbursement account. I know Suzanne was trying to fight for more than $3,000 for the cap, and I tried to fight for it, but I don't think they're going to raise it anytime soon. They said that they have not seen anyone enrolled in VIA benefits use more than that $3,000. So apparently that money goes a long way. You can use that for you can use it for your medical premiums. You can use it for your Medicare premiums to pay to Social Security, whatever you needed for prescription drugs. So that money is there for you. During open enrollment, you would submit the UBIN 100 form to enroll in your dental, vision, or legal plan. I mean, your dental or legal, because vision is not on there. So your dental or legal plan. And if you want to enroll in VA benefits when you move, you would also complete the UBIN 100 form. Now, what I suggest, if you plan on moving, do not complete any forms until you're actually in the state and have moved, because your 30-day window is going to start as soon as you change your address. When you change your address in the system, that's going to trigger your 30 days. So if you haven't left yet and you get there and you have a week left because you already started your clock. So do not start your clock until you're at an address, you're in there, you've moved. You have an address, fill out your forms, change your address, and start your enrollment into VIA benefits. That's what I suggest. So things to consider when choosing a plan. Check the drug formulary, because some drugs on UC Care is not available on the Medicare plan, or vice versa. What services do you need? Does the plan that you're currently on offer those services, or does another plan offer those services at a lower lower cost? Do a benefits analysis of the plan premiums if you can, according to your needs. You have the booklets, which Medicare plan is right for me. It has it laid out side by side, each plan. Review the evidence of coverage booklets. They are available on UCNet. Read the fine print. Go to the HCF website. There's lots of resources there. UCNet, there's lots of resources there, but read the fine print, because there's always something that we miss. So when can you enroll or change plans? Qualifying events are moving outside of the service area, enrolling a new child. Did you adopt? Did you get married? Did you get divorced? New domestic partnership? Losing coverage somewhere else, or you're in the health savings plan and you're going into Medicare. Your opportunity to change is during open enrollment, and open enrollment for this year is October 26th, 8 a.m. to November 17th, 5 p.m. Additional resources are UCNet. We just spoke about that. It's the HCF page. And then you have UC Raise, which is where you're going to go to do all of your paperwork. UC Raise is where retirees are going to go to make their changes during open enrollment. If you have a question, you can send questions to the RAS during on that site. And then you have myself. I thought I added you to this slide. I guess I did. You have myself, but our numbers are the same. Lilia could be reached at that number as well, and at the same email as well. You have my HCF help at ucsd.edu. There's also the retiree handbook, retirement handbook, Medicare fact sheet, which medical plan is right for you and which Medicare plan is right for you. These are all valuable resources. And then, of course, the HCF has resources as well. We do a help desk every second and fourth Thursday. And then we do have a presentation of health insurance after we retire every third Wednesday of the month. There is a pre-recorded version on the HCF website. And then the months of October and November will not be the retiree health insurance. It'll be open enrollment highlights for retirees. There's no registration required for those two, but there is another Medicare similar to this Medicare and your UC sponsored plan, but that's on UC Learning, so retirees don't have access to that. So that's why we do these. And then more tools. Again, we have that UCNet website, retiree medical plan costs and comparison. A quick reference guide. We just talked about the Medicare and Medical plan. That's right for you. Retiree health eligibility rules fact sheet, CMS's contact, Social Security contact, HICAP contact, the RASC contact, retirement associations info and membership info, via benefits, health HR benefits office, campus benefits info, and then you have us, the healthcare facilitator. Oh, see, I added you to this one. Healthcare facilitator, myself and Lilia. And I know I covered a lot. And I know there are several questions, so we're gonna go ahead and open. I love that picture. So pretty. So now we're gonna open the floor to questions.